All right, welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Oh, my pleasure. Thanks for having me.
Thank you so much. My name is Dilshad Burman. I am a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, the way it works is we've been collecting your questions over the past few days, and we will present them to the doctor today. She's never seen them before. It's all off the cuff. And if you haven't had a chance to submit your questions, you can still do so under this live broadcast. And we're going to try to get to as many questions as we can, both live and earlier submitted, in this short 30-minute period that we have with the doctor. We'll start off with vaccine questions today once again, because vaccines have been top of mind for quite some time. And then we'll go into other questions. If you've got questions that are not vaccine related, you can still submit them live and we will take them. So doctor, are you ready to go?
Yeah, let's go.
Okay, wonderful. So let's start off first with the submitted questions that I have here. We'll start with Jim. Jim says, should I, as a survivor of lacunar infarct, on a daily regimen of statins, ARBs, etc., take a specific vaccine or any one that is available?
Okay, so thanks for your question, Jim. So because you actually have lacunar infarcts, which are like stroke, you know, you may have had a stroke in the past.
Sorry, doctor, we seem to have some technical.
Yeah, can you hear me?
We can hear you, we just can't see you.
Yeah, okay, so I've lost my video, so I'll work on that. Okay, so as long as you can hear me, that's great, and I'll work on the video. So because you've had a past medical condition, certainly do recommend that you get vaccinated. The two vaccines that we have available now are the Pfizer and the Moderna vaccine, and any of those vaccines would be definitely recommended for you.
Okay, wonderful. And then we'll keep going on, doctor, as you work on your video. I'll take some more questions from our submitted stash here. Okay, here we go. We've got you back. Perfect. Sorry, from our submitted cache here. Tracy asks, I am a COVID survivor, and my question is, do I get a second dose as I already have antibodies?
So because you had COVID, the recommendations almost around the world, almost every country except for, I think, France, just a few of them are definitely recommending that if you had COVID, you should get 2 doses of a vaccine.
Right.
We know that the 2 doses of vaccine are safe. We know that they will work for you and they will give you longer lasting protection, including protection against the variants. So I would definitely recommend that you get vaccinated and that you get both doses.
The second dose, absolutely. And then let's see, Lorna asks, if you have had COVID and you had the first shot, when is it safe to get the second shot?
Well, it's safe and recommended you could get the second shot as early as 1 month later. If you know, when because the Delta variant is circulating, it's probably better that you get the second dose at that interval or, you know, within a month, because we know that the 2 doses will give you the best and the strongest protection. And that's really what we want right now. If we didn't have a lot of virus circulating, it wasn't the Delta variant, we knew we had really strong protection after 1 dose, we might say optimally wait for 8 to 12 weeks, because that's when we know you'll get the best booster response. So it's always about balancing, you know, what's going on at the time. So I would say get your second dose 1 month later.
Right. And doctor, the 8 to 12 weeks, is that for the mRNA vaccines as well? That's the optimal period?
Even with the mRNA vaccines, the studies have shown that a bit of a later second dose actually gives you a stronger immune response.
Okay.
But, you know, if in that 2 months of waiting you get COVID, well, then that was not worth waiting for, right? So this is why we're trying to balance that. Yeah.
Right. Okay. And then again, this is a question, it's all related. So Isaac asks, now, if I got COVID, should I still get the vaccine? And if your answer is yes, why?
So yes, you should get the vaccine. And the reason is because the COVID that you have, we don't know how long that protection is going to last you. And we don't know if it's going to give you protection to variants. We have the Delta variant now. Did you have Delta variant? We can expect that there will be other variants in the future as well too. And so that's why you should get it. As well, it's safe. It's safe for you to get the 2 doses as well.
Right. Okay, and then we've got some related questions here. So this is a question about boosters. Sheila and Casey have the same question. Any idea how long the fully vaccinated people are protected from COVID-19? And will there be around 3 or beyond, say in the fall, or, you know, like a booster dose?
Okay, so we're not recommending a booster dose right now for everyone. That's something that, you know, if we have a new variant where our vaccines don't work against the variant, then that's when we might consider giving a booster dose. And right now, the 2 doses of vaccine are providing good protection, actually. You know, many months later. I got my 2 doses in January, actually, because I work in the emergency department. So I'm approaching 6 months and still consider to have good protection. No need for a booster dose.
Okay. And then this one is from Sita. They ask, my daughter had the AstraZeneca for her first shot and Moderna for her second. She is 40. Will she need a booster to fight the Delta strain since she is not as protected as somebody who received 2 doses of Pfizer? This is something we've heard before, that if you get AstraZeneca, you're more protected from the Delta variant.
Yeah. So actually, if you have AstraZeneca for 1 dose and Moderna or Pfizer for your second dose, that's actually a very good schedule. That second dose is going to give you that added protection, that booster response. And no, there's no recommendation that you get a 3rd dose. So that is actually a very good schedule. We've actually seen in many countries in Europe where they've been able to show that 1 AstraZeneca, 1 messenger RNA works very well, even against Delta. Okay,
wonderful. And then Tanya is sending us a live question right now. We've just answered this, Tanya. Will there be a 3rd shot or another dose in future years? I just want to let you know we've just answered those questions. So we're going to go back to the ones that we have submitted. Lots of questions regarding travel and the vaccines. So Jay and Barry have a similar question. I'll read out Jay's. I have a surgery booked for September 1st in Indianapolis. For this, I'm required to be fully vaccinated, but I am seeing that at this time, the USA does not accept the mixing of Pfizer and Moderna, which is what I will end up having. Is there any way I can request Pfizer to ensure that my surgery can proceed in the US?
So actually, the US has the same policy that we do in Canada. And it says that if for your second dose, the exact vaccine is not available, you can get a similar vaccine for your second dose. So they do actually have that interchangeability feature in their guidelines from the CDC and the Advisory Committee on Immunization Practices. So you should actually be okay with 1 Pfizer, 1 Moderna, but you could certainly call the hospital right now to find out. I would say by delaying, to try and get Pfizer, again, the Pfizer shipments are not guaranteed. You're actually keeping yourself at ongoing risk. You could get COVID, even the Delta variant. So I believe that interchangeable schedule is something that may have occurred in the US even as well too, because there will be some clinics that would have had only 1 vaccine or the other. So I would follow up with that hospital there.
Okay. And then more travel questions here. Again, Casey and Deb have the same question. Let's read out Deb's. She says, both my husband and I are fully vaccinated with AstraZeneca and want to start traveling internationally. We've heard that many countries like the USA are not acknowledging this vaccine, which will inhibit us from traveling. Is this true? And can we actually get revaccinated with something else apart from AstraZeneca?
Okay, so I think some of the travel vaccination policies are very much dependent upon the country. But I think hopefully this is something that usually countries come out with their own guidance, and then usually maybe the WHO might develop something for the world that other countries will adopt. Yeah. So I think this is something you're going to have to keep a close eye on to follow. Even travelers, and the question really is is it that you cannot travel to the US, or is it that you might have to quarantine or have a testing or whatever? Because that's certainly the case in Canada. If you have one of the approved vaccines from Canada, we have 4 of them, and you come here and you're fully vaccinated, you won't need to quarantine if you don't have symptoms and you have a negative test. But if you have a different vaccine, you could still come if you're a Canadian citizen, but you will have to quarantine. So I think that's the other piece to figure out is what is it on which vaccine is being allowed? What are the restrictions if you have other vaccines? Right now, there is no ability for you to get revaccinated with, say, a messenger RNA series because you want to travel, for example. That's not something that is available. And I'm not sure that it's going to be necessary in the long run. I'm hopeful that some of the vaccination policies will be a bit more kind of inclusive of worldwide WHO approved vaccines.
Right. And Dr., in our past conversations, you've mentioned that Canada is working with other countries to, first of all, get the mixed dosage recognized as being fully vaccinated. And then I'm assuming AstraZeneca as well. So that's still ongoing.
Yeah, my understanding is that at the federal level, that is something that's actively being looked at. Yeah, and you can see even our top political figures have mixed vaccine schedules, right? Including our prime minister, including our premier, for example.
Yeah, absolutely, absolutely. And they have to travel around the world quite often, so I'm sure there's there's exemptions for that kind of thing. Hopefully. Okay, let's go back to our submitted questions here. Mirta asks, I am waiting for my second dose of Pfizer. I received an alert for AstraZeneca, which I canceled. Please confirm when the vaccines will be available, when Pfizer will be available for M4X. I don't know if we have specific data for that.
Yeah, so the vaccine shipments come in week by week. And so I think, I would definitely recommend for your second dose. It sounds like you probably got your first dose of AstraZeneca, which is why you were offered a second dose of AstraZeneca. I would recommend that you get a messenger RNA vaccine. Although you're saying that you want Pfizer. So I'm not quite clear on that, but I would say that the Moderna vaccine that's available now, and there are clinic appointments available this week, I would recommend that. I mean, between Pfizer and Moderna, there's not a lot of difference. The difference is in the name, but the actual vaccine product is very, very similar, will give you excellent protection and is recognized as a very good messenger RNA vaccine.
Absolutely.
And then in terms of, again, it's week to week, we find out about the shipment, so I can't guarantee when we're going to get enough Pfizer. The Pfizer that comes in right now, there is still some Pfizer coming in, but that's being reserved for 12 to 17-year-olds, because right now that's the only vaccine that's licensed by Health Canada for that age group.
Right, absolutely. And from personal experience, I know that it depends on the clinic. When I got my second dose, I got Moderna for my second dose. I had Pfizer for my first. And at that particular week, like you said, it's week by week. That week, there was no Pfizer available anywhere. So I took Moderna. The following week, my friends got Pfizer. So it's just, it goes week to week, it goes clinic to clinic. And like you said, they are entirely interchangeable. Proof here, I got the mixed dosage and I was fine. So I just want to say that it's true, even from personal experience, goes week to week, it goes clinic to clinic. Okay, so let's go to the live question coming in here from Marlena. This is something we've heard of a lot, and we recently did a story on it. Are there any reliable studies on vaccines and changes in the menstrual cycle?
Okay, so this is something that's actively being followed. Actually, I was just on the Public Health England website, and they actually are recording how often this is occurring, whether they're seeing more cases because of the vaccination. I think we have to recognize that menstrual irregularities are quite common. I've heard one OBGYN say it's 1 in 6 women have a menstrual irregularity. So if you vaccinate 6 women, you can expect that 1 is going to have a menstrual irregularity. They might say it's from the vaccine, but it was going to happen anyways. Right now, there is no signal, no evidence that these irregularities are occurring more commonly in those who are vaccinated, more than are expected. And as well, there's no evidence that any of these irregularities, if they are occurring after vaccination, again, not from the vaccine, but maybe after vaccination, there's no evidence that it's long lasting, that it's impacting fertility either.
Right, absolutely. And just to note, if anybody wants to watch the story that we did, our fantastic reporter Faiza Amin actually did this story yesterday regarding the studies that are happening in the UK. Like you said, Doctor, she spoke to, I believe, a reproductive specialist from the UK. So you can check that out on citynews.ca. Excellent story, and lots more answers there as well. Because like you said, this is a question that's been coming up a lot recently. All right, so we will go back to our submitted questions here. A asks, if 12 to 17-year-olds can get only Pfizer, how can the position be that Pfizer and Moderna are interchangeable and exactly the same? I took what was available for the first shot, and it really upsets me that now we're instructed to mix. I will wait to get the same shot for the second dose. So the question basically is, how come it's not interchangeable for children, but it is for adults?
Yeah, you know what, I understand why this can be considered confusing, and it's really just because Moderna was licensed for 18 and up. That's the only reason. Moderna is actually currently, the approval is actually with Health Canada for it to be approved for 12 to 17-year-olds. So you can expect in the coming days or weeks that Moderna will be for 12 to 17-year-olds. But right now it's only been approved for 18 plus. And so that's why, in order to give it down to age 12, we have to confirm that they've done the studies in the younger ages, that it's safe in them, that it works in them. And that Moderna did after the fact, behind when Pfizer did that. So that's why right now the Pfizer is being given only to the 12 to 18-year-olds, but that may change in the future.
Right. So it's mostly a timing issue more than anything else. They're just a little bit behind Pfizer in terms of approvals.
Yeah, and in terms of doing the studies, submitting to Health Canada, that kind of thing. Yeah.
Right. Okay. And then let's see. I don't know if this person's name is Wednesday or they submitted on Wednesday, but that's their alias. So Wednesday asks, if you have been fully vaccinated, can you still spread COVID-19? And when will masks and social distancing not be required?
Okay, so if you're fully vaccinated, you're certainly very less likely, first of all, to get COVID-19. If you get COVID-19, you're still even then less likely to spread it. The amount of virus that you have, even if you got COVID-19, would be much lower. And, you know, the statistics are, if you're vaccinated, the protection is very, very high, 90+% of protection, you know, for getting COVID. So it's very good. Now, the question is, well, then why do we still need to wear masks? Well, we don't have very high vaccination rates. We have good vaccination rates, but for the Delta variant, we need a very, very high vaccination rates. And so, you know, until we get to that very high level and we know that the Delta variant is not spreading, we have to make sure that we don't continue to spread the virus. And that's why we're recommending it, especially in those indoor settings, right? When you can't keep a physical distance or you're in an indoor setting where we know the risks are higher.
Right. Okay, and more submitted questions here. This is interesting. Crystal asks, is it legal for businesses to ask for proof of a customer being vaccinated?
Okay, so I'm not a lawyer, I'm a doctor, but so I don't know about the legality, but I do know that workplaces, private places can have their own policies as long as it doesn't go against the Human Rights Code. So yeah.
Yeah, absolutely. Private businesses, I mean, we've seen that with masking as well. Private businesses are able to, you know, to ask you to wear a mask to enter their premises for sure. And then, Doctor, we've lost your video again, but I'll keep going.
Okay.
To still hear you, and if we can get your video back in a little bit. Gary asks, if I got my first dose out of province, how do I update my details for Ontario to be eligible for the second dose?
Oh, good question. So we actually now have a process in place. So if you live in Toronto, you could call Toronto Public Health. What we do is we take your record for the vaccine that you got, and then we input it into COVAX, that database, so that it's in there, and then it allows you to then book your second dose accordingly. So there is definitely a process in place. If you don't live in Toronto, then you can figure out where your local health unit is to try and get that added into the system.
Excellent. And then Sarah asks, Is Ontario doing any trials to test vaccine effectiveness on immunocompromised people, as well as what additional protection a third dose might offer that group? So let's start with that question first. She has a follow-up, but let's start with that question. Are there any trials ongoing for effectiveness on immunocompromised people?
Well, I do know that many of my colleagues who work with immunocompromised patients, like transplant patients, have been doing studies on this, actually. And there is certainly stuff published in the medical literature, you know, even from around the world on this piece. That question about whether if you have a very weakened immune system, like you've had a transplant, should you get a third booster dose for protection? I think that's something that I know places are looking at, but there are currently no recommendations for it right now.
Okay, and then the follow-up question that Sarah has is, with antibody tests being offered, will antibody tests be offered that are more than just a yes/no, which is available now, just to determine that you have the antibodies, so that we can find out what coverage immunocompromised patients have after the second dose?
Yeah, I would actually be cautious about getting an antibody test. There are many different types of antibodies. Again, in your immune response, you actually have a B cell response, which is antibodies. You also have a T cell response, which is not detected by antibodies. And so it's really hard to interpret those results. Is that antibody specific enough for vaccines? If you have immunity from vaccines, there are many different antibody tests on the market. And so, you know, unless they're very well correlated to vaccine immunity, I wouldn't recommend them. And even if they are, I still wouldn't recommend them. I would focus on making sure that you have the documentation of the 2 doses. And again, this is being looked at on some of the scientific committees to see whether, well, maybe for certain populations, they should get a third dose in the future.
Right, okay. And then, okay, JJ asks, the WHO has revised their recommendations as of June 3rd. It clearly states that it is not recommended, the vaccine is not recommended for children under 18. So why is Canada recommending to vaccinate children still? This is what JJ says.
Okay, I believe the WHO actually revised their recommendation even further. Originally, when they made that recommendation, it was really to ensure on a global perspective that the vaccines were given to the most at-risk adults, which are not the younger children, so that internationally you could make sure that all adults who were 60 and up were vaccinated. That was part of why they made that statement.
Okay, okay. Sorry, and then we'll move on to okay, this is an interesting one about vaccine intervals. Liv asks, my second shot was delayed, like in most cases, by about 3 months or so. How do we know that having had my second shot, I am fully protected as compared to those who had the second shot in a much shorter interval time?
So we actually know that the second shot, no matter what the interval is, gives you a booster response. So, you know, except for looking at some of the studies that have been done, again, it's all about balancing those risks. And right now we're recommending that shorter interval. Remember, we only extended that interval because we didn't have a lot of vaccine. It was really because of vaccine supply. Now we actually have enough vaccine supply so we can give a shorter interval. And we have the Delta variant where we know that you really need those 2 doses to get the best protection. And so that's why we're recommending that shorter interval. So, you know, as we talked about, if you could extend that interval 6 weeks, 8 weeks, it might give you a slightly better immune response, but then you're more at risk for Delta while you're waiting. And so that's why we're recommending that shorter interval now, especially because we have vaccine supply too.
Right, absolutely. And so if in terms of comparisons, I waited 6 weeks, somebody else waited 2 months, I don't necessarily have better protection than the person who waited 2 months. You said the second dose boosts it no matter what, right?
That's right. That's right. So you would, by the time you get your second dose, you will have a strong boosted immune response.
Right. Okay. We have a few more minutes, so we'll keep going here. Phoebe asks, and this is another question related to menstrual health. Phoebe asks, I've been treated for PCOS over the last few years. Sorry, this is connected to blood clots. I've been treated for PCOS over the last few years, and birth control is part of the medication I am on. Now, birth control has been known to cause blood clots, but luckily, Phoebe says they haven't had any. But there's lots of stories about the COVID vaccines causing blood clots. Should I take the vaccine while being on birth control?
Okay, so Phoebe, good question. Let's first clarify, though, that the severe blood clots you can get from the vaccine is only related to what we call the viral vector vaccines. And so that's AstraZeneca, Covishield, and the Johnson & Johnson vaccine. But with the Moderna and the Pfizer vaccine, those are the two vaccines that we have available, there are no associations with blood clots. So absolutely, if you're on the birth control pill, if you have PCOS, you can get the Pfizer or Moderna vaccine without worrying.
And then, doctor, we've talked about, I know that right now we're not really working with AstraZeneca here, but are those blood clots actually related to any other kind of blood clots or any other medication that you might be taking that increases your risk to blood clots?
Yeah, thanks for following up on that question. Actually, even with the AstraZeneca vaccine, you're okay even if you're on the birth control pill, because those clots are formed in a different way than compared to being on the birth control pill. It doesn't put you at higher risk either. Yeah.
Yes, absolutely. Okay, and then okay, Omar asks, talking about intervals, Omar says, if I took my first dose of COVID-19 vaccine this week, can I take my second dose in a 1 week interval?
No, you can't. No, you can't. So I would recommend that 28-day interval, actually. So that 1 month interval. With Pfizer, you can go as short as 21 days between two Pfizer doses. But again, you can't be guaranteed what your vaccine is going to be. So that's why I would say 28 days between doses for that second booster dose.
Which is sort of the minimum base level, you need 28 days.
The minimum, that's right. Yeah.
Okay. And then, okay.
And if I could just say, that's why we want you to get vaccinated now, because you are going to have to wait. And this is especially important for youth, for 12 to 17-year-olds. Get vaccinated now so you have enough time to get that second dose before school starts, because really the clock is ticking. Yeah.
Yeah, absolutely. And September will be here before you know it. Time moves really fast. All right, so let's go to Sadie's question here. If all of my family, my household of 4, my sister, my parents have all had both vaccines and we waited our 2 weeks, can we be unmasked in my house and can we hug?
Well, actually, so what I would say here is let's follow Ontario Step 2 guidance. And in Step 2, you can have 5 people indoors. And if you're all vaccinated 2 weeks after the second dose, there are no kids who can't be vaccinated, for example, that would be a low risk situation and you wouldn't need to wear masks. I would say that you should ask your guests before they come, do you have symptoms? Are you not feeling well? Because if you do, please don't come. That's one thing that I would say. And right now the limit is 5. And so you would have to follow that as well.
5, including the people in your own household, a total of 5.
Yeah, total of 5 indoors. Now, what I would say is take it outdoors, because outdoors you can have 25.
Right, absolutely. Lots of picnics in the future for summer, for sure. Okay, Malik asks, how many years will 2 doses of Pfizer or Moderna give protection? And in case of the expired immunity after that time, can we use medications like antivirus medications like remdesivir, Actimra, biologics, ivermectin, dexamethasone, et cetera, et cetera?
Okay, so that list of medications, not all of them are used to treat COVID. Ivermectin, for example, I know people talk about it, that's not related to a COVID treatment. But if your immunity wanes from the second dose, and now we're finding that COVID is spreading, especially among vaccinated people, I think that the answer there will be a booster dose of vaccine rather than having more people take antiviral medications.
Right. And doctor, as far as antiviral medications are concerned, are these something that we're actively looking at as a therapeutic or sort of preventative? Will this be recommended, do you think, in the future?
Right now, it's just a therapeutic. We know for influenza, we have a couple of drugs that if there was an influenza case in a long-term care home or an outbreak, that people could go on the medication for prophylaxis to prevent them from getting sick. We don't have that for COVID right now.
Okay, good to know. And we have 2 minutes left. this is interesting because we just talked about gyms and spreading the virus in gyms over the course of this week. Sam asks, I am dismayed that gyms are being left out of the reopening. It is so important for a person's physical and psychological health. Aside from a few documented super spreader events, is there documented epidemiological proof that gyms are higher risk for spreading COVID? Yeah, that's the question.
Yeah, I think we actually had a lot of experience from Ontario, actually, that those indoor settings in gyms they're not even just for super spreaders. They're actually spreading events. The virus spreads in those settings. Now, what I would say is right now we have Mother Nature on our side. It's nice outdoors. We can go outdoors. Those outdoor gym facilities, outdoor gym classes, right, are something that I would highly recommend because they are much lower and will allow you to get back to doing, that gym type activity without that risk.
Yeah, absolutely. And in terms of, we're just going to wrap up, but I will mention in terms of spreading at gyms, we do have a story on citynews.ca about a gym in Oakville that unfortunately had to shut down because they were running under a physical therapy exemption. And unfortunately, they had 15 cases of the Delta variant in that gym. And so they did have to shut down. So in terms of documented evidence, we have that up on our website right now for you to check out, citynews.ca. That brings us to 12:30. Thank you so much, Doctor, for joining us once again. Thank you to everybody that submitted your questions, both live and earlier this week. We will have the doctor back with us next week. If we didn't get to your questions, we will get to them next week. Thank you again, Doctor.
Bye.
Okay, bye-bye.